Pain is a big part of the human experience, but it's also extremely complex. And for an estimated 50 million adults in the U.S. living with chronic pain, it's consuming. As is told in the new book, Song of Our Scars, The Untold Story of Pain. The author is Dr. Haider Warraich, who joins me now. He's also a physician at the VA Boston Healthcare System and Brigham and Women's Hospital, as well as an assistant professor at Harvard Medical School. Dr. Vareichs, thank you so much. You came to write this book out of your own personal experience. You were exercising while you were in medical school, and weights fell on you, and I believe you injured a disc, you ruptured a disc in your spine, and that sent you on a path of chronic pain. Have I summarized that accurately?
Very accurately, and I'll take it from there. I was a young medical student who thought I was invincible and immortal, and who had gotten hurt before, like so many of us have. But before this, every time I'd gotten hurt, I'd gotten better. Even though I had pain, even if it stayed for days, sometimes weeks, it went away. But this time when I hurt my back, those days became weeks, and weeks became months, and months became years, and my entire life changed in a way that I could never have imagined. All the dreams that I'd had of even becoming a physician seemed to be slipping away from my grasp. And eventually, though I got better, after a while, I realized that while my story was important, there was a much bigger story to be told, and that's the story of people in pain and of pain itself.
So your book, it dives into the history of pain, the biology of pain, the management of pain. Why do you say the experience of pain saved my life?
Well, in a way, it saved my life because before that, I had no sense of what real suffering can be. And in a way, that is so central to knowing that as a physician. As a physician, we are faced with suffering all the time. And it's too often physicians and nurses and other clinicians have no experience of that type of illness that they're treating themselves. It's almost like they're chefs at a restaurant, but they have never tasted the food.
And that's one of my favorite quotes in the book, I have to tell you. I sort of stopped at that. And I do want you to dive more into that. What does that mean we should be doing? I mean, the oncologist should have cancer, or, maybe I'm taking it too literally, but
it is unfortunate, but sometimes it does take experiencing something to really experience the full dimension of it. And I don't think that I'm a cardiologist, and I don't need to have a heart attack to best treat patients who come in with heart attacks. If you're an oncologist, you don't need to have that experience to be able to pick the best treatments for your patients. But I think for pain, because it is so subjective, because it is something that can be so essentializing, and because it is a phenomenon that we really don't understand as well as we do things like heart disease and cancer, that I do think that my brush with pain, more than a brush with pain, did change me in some ways for the better, because it gave me a window into the suffering of others that I just didn't have before. What I want to do through this book is make sure that others don't have to undergo something that I did to have the similar perspective when they treat someone who has pain.
So you have a pretty damning view of the way this country treats pain. You say that drugs are ineffective for chronic pain. You say we focus too much on completely eliminating pain. Can you elaborate? What is wrong with the system?
Where do I begin? I think one of the things that became very clear to me that I didn't know, even though I treat patients with pain, all the time, and I've had pain myself, was that chronic pain, which is actually very different from acute pain. Acute pain is the sort of pain you might have after, let's say, you break your arm or bruise your ribs. But chronic pain, which is something that 1 in 5 Americans and people around the world live with, is a very, very different process, and that many things that work for acute pain quite well actually are not that effective for chronic pain. The example that comes to mind is, for example, opioids. Opioids are powerful painkillers that are some of the best therapies we have for acute pain. And yet, when it comes to chronic pain, even though they help some patients, the best studies suggest and reveal that in most cases, they actually increase how much pain people have over time. And to me, this is there's been so much talk about the opioid epidemic, but what we haven't talked about is how we got here and what is next, especially for people who live with pain, and how best we can treat them. And one of the other issues with our health system is that it has become, unfortunately, so focused on profits and efficiency that the human element, which is so critical for the person in pain, has gone altogether missing. And I think for us to be able to treat the person in pain better, to understand pain better, we really need to make sure that patient-centeredness is not just a buzzword we can put on billboards, but really something we can integrate in our health system.
So where does that come into play, and how do you put that balance back? Is that about talking about empathy more in medical school? What is it that you're suggesting? I mean, taking power, moving it from pharmaceutical companies, that's a pretty big ask.
Well, so empathy is something that has been shown, in fact, to be extremely effective when it comes to helping people heal from pain. In fact, empathy is the reason why people experience the placebo effect. This idea that someone cares about them, and the hope that they will feel better is really central to our body's own ability to provide us pain relief. But it's not. But interpersonal empathy is just not going to be enough. Our health system, because it prizes profitable procedures or things that we can do fast, like prescriptions, ensures essentially that we just never get time to spend with patients in the clinic or in the hospital. And so the first thing that I think physicians need and nurses need is more time to spend with their patients, because just the act of telling their story can be something that can heal the person who suffers. But the other thing is that we actually know that there are so many other therapies that are extremely effective for people in chronic pain. And that is what we need to do, is that we need to increase how much access patients with chronic pain have to all these other alternative therapies that we just haven't provided so far.
So I do want to ask you about those, because you talk very specifically about certain things. You talk about something called pain acceptance therapy, which to some people might sound like just giving up, counseling you to turn away from potential options. Can you explain what that means? Pain acceptance therapy.
Sure. So, one of the things that pain does is that when pain is the loudest alarm that can go off in your body. So as soon as we are in pain, our entire attention is focused on it and making sure that we can eliminate it at all points. That's really how I felt when I was in pain. My main focus was to make sure that I'm never in pain. When my friends would go out for birthday parties or dinners, I would rather just stay in my bed. I would just rather stay in my dorm room, because my I just couldn't bear the pain of just getting in the car, or being around other people who seem to be doing just fine. But what pain acceptance does is, and it's not the same as resignation. What pain acceptance does is that it shifts the person's focus not so much from trying to control the pain at all points, but to maximizing how they live their life. So what that essentially would mean for someone like me when I was suffering was, someone would talk to me and tell me that even though it might hurt to be in that car, even though it might hurt to be at that birthday party, that I should not limit my life just so that I can stay pain free. But the other thing that even newer forms of therapy, such as pain reprocessing therapy, are doing for patients with chronic pain is that they're taking the fear away from pain. For
Okay.
many people in chronic pain, the strongest emotion that pain evokes is a fear. When I had extremely bad back pain, when it would hurt, I would almost worry that would I paralyze myself? Would I splice my spine in half?
Right.
And
So,
pain reprocessing takes that away from patients.
okay. Unfortunately, we have to wrap it up, but I do want to point out, Doctor, that you underline the role of exercise as something which needs to be focused on more to relieve pain. You talk about something fascinating called the open label placebo effect, which is essentially a doctor can give you a placebo but tell you it's a placebo. It still has an effect. There's a lot to be explored in your book. Dr. Haider Warraich, thank you very much.
Thank you so much for having me.
The book again is The Song of Our Scars, the Untold Story of Pain.